I would like now to introduce to you Dr. Lieve Fransen. It's really a very great honor, Lieve, Dr. Fransen, to have you here. I don't really think that I have enough time to go through your incredible track record. But you are a doctor, a policymaker, a very courageous person who has always put at the highest level the needs of the health challenges that we face most of the time in relation to Africa or other places with big challenges, but always with a very important global impact for all of us. And well, I remember when we first met, when you were leading the Global Fund on HIV and AIDS, and you had moved into the European Commission as one of the key policymakers really on health and education in Africa. You've been present through so many crises, the Ebola crisis, and then again at the beginning of this pandemic, you raised your voice loud and clear and with very clear vision on the things that needed to be done. And we all know that these things take time, but then again, we also realize today that you were right when you were raising these issues. And I would like to ask you, and it's a big honor for me to give you the floor, but I would like to ask you to explain to us really in simple terms the technical letter of Dr. Tedros. What does this mean? Why is it important? And why do we really need this collaboration between Africa and Europe? Dr. Lieve Fransen, the floor is yours.
Thank you, Professor Van Rijssen, Miriam, dear President of the Pan-African Parliament, ladies and gentlemen, professors. It's a very big honor for me to be here and speaking to all of you. And I think it's, I also want to thank Professor Van Rijssen for organizing this very rapidly, but very impactful with all of the presence. And just right a few hours before the official opening of the summit, actually here in Brussels. But most of the leaders are already in town. So I'm very honored to participate, and I'm trying. I think we should try to be I would like to try to be as concrete and honest as possible. I think a real partnership deserves that. I share the hope that Miriam expressed, and I share the collective aspiration that was mentioned by Mr. Sharon-Bira. But we also need to have an honest discussion 2 years after the start of this pandemic. It's exactly 2 years, that, or a few days beyond, that the first case was discovered in Africa, actually, in Ethiopia, actually. In the meantime, 6 million people, we don't really imagine anymore what that means, 6 million people. I also think 200,000 healthcare workers have lost their life. To me, that is also very important, because there is already not enough healthcare workers across, even not in Europe, but also surely not in Africa. And only 1 out of 5 healthcare workers have been vaccinated in Africa. I mean, can we not do better to protect at least our essential workers in the front line here? I mean, to me, it still shocks me. The rollout of the COVID vaccines, as Dr. Tedros explains, a lot of efforts have been made. For the moment, there has been a production of 9 billion vaccines worldwide, but only 540 million vaccines have been sent to Africa. That means 1.2 billion Africans have not been receiving 1 dose yet. I mean, 2 years later. So I would like to highlight a few points in response to the first letter that we sent and Tedros and the actual situation. Of course, I cannot touch on everything, and I think I'm very keen actually to listen to all of the presentations and the debate also very much. So I selected a few points. A few points that I would like to highlight on production, procurement, and supply of pharma products. A second area, very briefly, on how to reboot health research also for the public interest in Africa. And of course, I expect much more from all of you also to contribute to all of this, because you are really at the front line. A lot of the professors are at the front line of all of this. And then I would like to highlight a few points on what a real and equal partnership between Africa and Europe would mean in these areas, and highlight, each time I will try to highlight a specific point that could be done together between Africa and Europe to influence a change at a global level. So first, on the localization of production and procurement and supply of pharmaceutical products. When this epidemic started, we knew actually, and we have to be honest on this, that the COVID epidemic required a different approach. And that was when I immediately wrote to the European instances with a proposal. We knew that the whole world would need the products that were produced, vaccines, testing, treatments. Soon there are more and more treatments at the same time. And we knew that the capacities were not there globally. And we knew also that Africa had the least capacities to do so for the moment. Only 1% of production is still present to produce the vaccines in Africa, whatever vaccines for the moment. So we knew all of this. We cannot hide behind this. What I didn't know, actually, when I wrote, was that the G7 countries would actually monopolize access and purchase quantities at much higher level than our own populations in Europe needed, or in the G7 countries needed. I didn't know that. I didn't expect that. So, but with all of this, I did write a proposal to the European Commission, and it was in preparation of a summit, an African EU summit that was proposed in 2020, and that never took place, actually. And so the proposal didn't manifest anything really at that stage in Europe, but Africa moved. The African CDC and the African Union developed a strategy for manufacturing. And I'm personally been involved in that. And I was very, very much impressed by the strategy that has been developed to move now for 1% to producing locally to 60% in 2040. And the strategy is really very well developed and thought. So Africa, in the meantime, also created an African Medicine Agency. And I congratulate the Africans for doing that. And there is now a collaboration being set up between Africa and Europe Medicine Agency that is, for the regulatory aspects, very important. Then Europe finally announced also support for the localization of production. And very recently, I think the momentum of the summit helps, of course. A lot of movement has been happening in Senegal, in South Africa, and now in Frankfurt, or in somewhere around Frankfurt, with the pop-up factories that will come up in Senegal and Rwanda in collaboration with BioNTech. Now, one word about the donations. In the meantime, what Dr. Tedros refers to is the many donations that have been made by Europe, but also by China, Russia, India, but not enough and not fast enough, because we still have, as I said, 1.2 billion Africans not vaccinated one time. So I argue that if we had moved 2 years ago, when I wrote this proposal in a way, and if donors and investors had invested then, we would have a few million less people died. And the economy would probably be less challenged in Africa and everywhere in the rest of the world. I will not have time to talk about the economy, but the revitalization is also, of course, very important. So I expect that this summit, and I hope that we share that this summit really clarifies not just grandstanding and promises that will not be implemented, but really what is the real ambition? What are the detailed plans prepared by, is Europe really responding to the strategy that has been developed by the African Union, or doing something else? Are we going to focus more not just on filling and finishing in Africa? Are we going to do more than voluntary licensing that didn't happen until now? I mean, a lot of questions in details that we should look at the outcomes of the summit and also monitor it, after. The discussions on the waiver are still going on. I think there is a way around this probably that has been found. So I would like to highlight one issue at global level here. If Europe and Africa works well together, we would, I mean, the issue here is that donations and procurement of vaccines for the moment are mainly organized in Geneva and Copenhagen. That means that localization of products and manufacturing in Africa doesn't really have an African market. So global level, we need to develop a joined up approach. The procurement and supply, not only the manufacturing, needs also to be in Africa. Because otherwise we will have production there and we will not have a market. And that will be an excuse for saying, you see, it doesn't work in Africa. So that's one thing that I would like to highlight. The second area is about science preparedness, the concerns about science preparedness, public health professionals, and data. Africa, for the moment, share in the global production of research has doubled in the 20 last years. And many of you have contributed and are contributing to this. And so congratulations for this, because doubling in 20 years is a lot, and that goes actually much faster for the moment. So European and African university collaboration, you know everything about it. I started my career like this, but you are all working still in these areas, and a lot of possibilities are there. Emergency responsiveness for epidemics now and in the future also requires science preparedness. And science preparedness should be an integral part of the emergency preparedness. And that still needs to be developed further in Africa and in collaboration with Europe. But we should recognize that the epidemic research in Africa has been very valuable, not only for Africa, but also for the rest of the world. The recent reporting of South Africa of the genomic sequencing of what we call now the Omicron really was an important sign for the rest of the world. At the same time, when South Africa reported it, we know that now there was already the same Omicron in the Netherlands, for example, but it was reported by South Africa. So it shows that this is an African pathogen genomic initiative, as it exists in many of the countries in Africa, is very important for the rest of the world. Africa has also been involved very much in the development of vaccine and treatment trials for Ebola, malaria, and COVID now. Sadly, the products of this research are not always in priority as accessible in Africa. The African CDC has done an enormous, and I really congratulate them, because they have, in 5 years' time and in 2 years of the pandemic, but before that also Ebola, have done an enormous job in a range of areas to develop the institutions and the networks that are needed, but also to promote synergies in research and disseminate the research fast. To me, to formulate a critical step forwards would be to strengthen European-African science collaboration, is to shift it from time-limited project-based funding to long-term commitments, like clusters of excellence. And I think there's some basis for that already being developed, but I think this in epidemic preparedness would be very much valuable to not have each time a project, but really a cluster of excellence in this area. On the other hand, COVID pandemic demonstrated how epidemic data, epidemiological data are very often in some areas not available in sub-Saharan Africa. And this knowledge gap is further aggravated by a shortage of skilled personnel in epidemiology, biostatistics, to efficiently monitor, analyze, and interpret these data. So to me, the scientific capacity building agenda to be developed further needs to be added also to the skills building. A global concern that we could do work on together is the policy issue to try to resolve is whether governments that negotiate differently, signing one purchase contract after another, like we have seen in Europe here, could we not make sure that there are some conditionalities on these contracts also? Not only on price, but also on technological transfer, on developing localization of manufacturing, on local procurements, and so on. I mean, for the moment, not enough has been done in that area. And again, it's something that needs to be solved at global level because the US did the same thing. Then I already mentioned the last point on the lack of health professionals. Do you know that actually WHO, and Tedros didn't mention this, but it's an issue, it's a very important issue also, of course, and WHO mentions that between 2015 and 2030, there's 1.4 million health workforce missing in Europe, but 6.1 million in Africa. That gap in Africa is even increased now, with an increased number of people exposed to COVID and not vaccinated. The African CDC has developed a framework for public health workforce development, and this needs strong support from all of you and from European support. Not just making people come to Europe for training, but set up master's degrees in Africa. The last point that I said I wanted to mention, because our data. You mentioned this already, President Sharon Bira and Miriam van Rijssen, I think. Data are, of course, very important. Power today is who controls the data. And so I would like to argue for a pathway towards an African health data space, working together with the European health data space. The creation of the health data space in Europe is one of the priorities of Europe. It will promote a robust exchange and access to different types of health data to support healthcare, health research, epidemic preparedness, and policy-making purposes. Europe can pioneer an ethical and human rights-based legal framework for digital health and data management. There may be best practices and lessons of interest for the African Union in designing and developing their own frameworks for the continent. As many of you are involved in this, I would really like to see this as one of the outcomes of the summit or beyond. Because at global level, that would mean that Africa can establish if Africa can establish a similar health data space, an opportunity at global level would be both data spaces aligned to focus on interoperability, promote open standards, personal data protection and privacy, and build a vibrant approach to digitalization for health. Telemedicine, telehealth is one of the possible futures also to reach the most vulnerable, the most difficult to reach, and decrease the number of the gap in the health professionals. During the epidemic, the worst of the epidemic, I was actually in India setting up telemedicine. reaching out to Professor de Jong actually at that stage. But in conclusion, I think we should highlight the importance of regional cooperation. Not everything needs to go through Geneva or Copenhagen, despite all of the efforts, very wonderful efforts that WHO and UN are doing. Because sometimes we undermining and disempower the countries themselves. Pandemic preparedness needs speed, not 2 years waiting to get in action. Agile systems, it needs trust, it needs ambition, it needs regional institutions and enlightened political leadership that goes beyond a me-first approach. It is my hope that Europe and African leaders will take bold and ambitious actions to correct the inequity that is going on for the moment. I'm hopeful with all of the movements that I see in Brussels for the moment, but I hope it's not just a peak because of the summit and it goes further away. But one good news that comes out of all of this COVID epidemic is that Africa, what I see, Africa recognizes the need to emancipate itself from the global north. This emancipation itself might help Africa to become more resilient and not create new dependencies. Too many examples show how the global health structures invented decades ago are about the North to give the South what the North thinks they need, not what they want. So together, I believe that we can make a change in global health for real, to be better off together in front of epidemics and health for all. Thank you very much.
Thank you very, very much, Lieve, for setting this out in very, very clear and stark and honest terms. I think that a number of things that you have touched upon are going to be a theme across this conference. One thing that you started with and ended with is localization. You're talking about localization of the vaccine production, but you are also talking about the fact that localization creates ownership, creates respect for sovereignty, creates trust, and that based on that, collaboration can be so much more agentic and meaningful. I think what you have set out is a very important set of elements that can help us come out of this, what Honorable Charumbira referred to as collective helpness, into something where action at the local level is a source for collaboration across our different places. And what was really impressive is how you translate the big numbers, like 1.4 million and 6.4 million health workers missing, respectively, in Europe and Africa, how these big numbers translate into very concrete proposals for action, and showing that this is actually possible. I did feel, listening to you, that this conference here actually comes probably 1.5 years too late, but it is important that it's happening now, and it is good that we are having this conversation here today.